This is a community group presentation on HIV. The following members who participated in this presentation are Hannah Gabison, Sarah Kupsak, and Natalie Serrano. These are the objectives that we will be going through during this presentation. So we will be talking about what is HIV, what the prevalence is in California and the San Joaquin County, what are some signs and symptoms to look for, what are the risk factors, what are some preventative measures that people can take, the resources available to the community, and also going over Healthy People 2020. To start off, what is HIV? HIV is a virus that attacks the body's immune system, and if it is not treated, it can lead to AIDS, which stands for Acquired Immune Deficiency Syndrome. This can happen in 5 to 10 years depending on the person and how long they've been left untreated medically. This makes people more vulnerable to other diseases. This is because when this virus attacks your body's immune system is down and can't defend itself against other types of diseases. This spreads by contact with other certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. There is no cure yet for this virus, but it is treatable, and if treated continuously and on time, we can stop it from progressing to AIDS. First, I'll be discussing the prevalence in California. In 2018, approximately 131,013 people were diagnosed with HIV. 88.2% of those people were male, 11.8% were female, 37% of those people that were reported were white, 16.6% were black, and 38.1% were Hispanic. These age groups also range from 2.4% in the youngest age group to 36.9% in the oldest age group. To the right, there is a map of 2019 of California and the different areas that are labeled with HIV prevalence. Next, I'll be talking about HIV prevalence in the San Joaquin County specifically. So this is just HIV, not including AIDS. A total of 919 people with HIV were reported to the San Joaquin County Public Health Services. 82.9% of these people were male and 17.1% of these people were female. 99.2% were adult and only 0.8% were pediatric. Then we also have, that's the cumulative HIV cases. Then we have HIV prevalence. There were only 544 people living with HIV in the San Joaquin County area, with 81.4% being male and 18.6% being female, 99.1% of those being adult, and 0.9% being pediatric.
Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue, and recurrent infections. Some people may experience pain in the abdomen or swallowing, diarrhea, nausea and vomiting, headache, or oral thrush. Now, if you think you may be infected with HIV, usually the first sign is fever. Women can also have changes in their menstruation cycle, have lower belly pain, and a yeast infection in the later stages of infection. Here we're going to talk about risk factors, and I believe the most important thing to know is the mode of transmission. A person can be infected with HIV through contact with bodily fluids such as blood, semen, or pre-seminal fluid known as pre-cum, vaginal fluids, rectal fluids, and breast milk. This can be transferred through blood transfusion and organ tissue or tissue transplants. Needle sharing or getting a needle stick by a contaminated needle also can be transmitted through intercourse with both homosexual and heterosexual relationships, through vaginal, anal, or oral sex. In addition, there are many myths about HIV. However, the Centers of Disease and Control Prevention stated it cannot be spread through saliva, casual touching toilet seats, or from mosquito bites. Now keep in mind other risk factors include a person's socioeconomics. For example, people who are homeless. Also a person's occupation, such as a healthcare worker being exposed. and a person's individual lifestyle factors such as a drug abuser. Preventative measures. You want to protect yourself during sex. Choose sexual activities with little to no risk. Oral sex is a little to no risk than anal or vaginal sex. Use condoms the right way every time you have sex. Usage of water-based or silicone-based lubricants to help prevent condoms from breaking or slipping during sex. Take PrEP. It's a pre-exposure prophylaxis medication given to people who are at risk for HIV. Consider abstinence, not having sex, or having one partner. Also, you never want to share needles, syringes, or other drug injection equipment. And lastly, get tested. If you suspect you might have been exposed, get tested because the early detection, the sooner you can get treatment. Now, the health resources available and how they benefit the community focuses on the San Joaquin County. There are many different clinics for testing or offering more information on HIV in the county. But in the San Joaquin County Public Health Service offers free testing and pre-exposure prophylaxis. They accept walk-ins on Tuesdays and Thursdays from 1 to 4 p.m. And in order to get the PrEP medication, you have to make an appointment. This is provided to anyone in the San Joaquin County.
Healthy People 2020. The national patient safety goals are derived from the Joint Commission. The focus goal was on reducing the risk of healthcare-associated infections. HIV patients are immunocompromised. That means that these patients have a weakened immune system due to HIV being a retrovirus. The patient is susceptible to infections, both community and hospital acquired. Hand hygiene for the staff and the patient and proper personal equipment is vital when in contact with these patients. So for reflection, linking to and staying in HIV medical care, meaning starting treatment and continuing that treatment. Increasing the availability of ongoing HIV prevention interventions. Providing prevention services for their partners through the partnership among health departments, community-based organizations, healthcare, and social service providers. Diagnose people infected with HIV. We need to get them virally suppressed and provide prevention and support services. This is a fundamental public health strategy for HIV. Antiretroviral therapy, meaning HIV drugs, screening and treatment for other diseases, such as STDs, as well as mental health services. Getting diagnosed can be mentally and emotionally taxing on the patient, their partners, as well as their families. And this concludes our HIV presentation.